Hey there, and welcome to your NCLEX RN preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. Once I finish reading the question, you'll have some time to think through your answer. Keep an eye on the timer in the top right corner. It's your countdown to make the right choice. When the timer hits 0, we'll break down each option together. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. Which of the following statements from the patient indicates that they understand the purpose of taking corticosteroids for increased intracranial pressure? The options given for this question on the screen are: Option A, I'm taking corticosteroids to reduce my body temperature. Option B, I'm taking corticosteroids to prevent seizures. Option C, I'm taking corticosteroids to maintain my blood pressure. Option D, I'm taking corticosteroids to decrease cerebral edema. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time to think. The correct answer is option D, I'm taking corticosteroids to decrease cerebral edema. Corticosteroids are given to stabilize the cell membrane and reduce leakiness of the blood-brain barrier, which helps decrease cerebral edema. Option A is incorrect because antipyretics are used to prevent temperature elevations, not corticosteroids. Option B is incorrect because anti-seizure medications are given prophylactically to prevent seizures. Option C is incorrect because blood pressure medication may be required to maintain cerebral perfusion, but not for taking corticosteroids. Which of the following statements from the patient indicates that the unconscious client is experiencing dehydration? The options given for this question on the screen are: Option A, the client has edema in their legs. Option B, the client has normal urinary output. Option C, the client's skin is intact. Option D, the client has not had anything to drink in the last 24 hours. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time to think. The correct answer is option D. The client has not had anything to drink in the last 24 hours. Dehydration occurs when there is a lack of fluid intake or excessive fluid loss, and one of the signs of dehydration is a decrease in urine output. Option A is incorrect because edema is a sign of fluid retention, not dehydration. Option B is incorrect because normal urinary output does not necessarily indicate hydration status. Option C is incorrect because intact skin does not provide any indication of hydration status. Option D is correct because the client not having anything to drink in the last 24 hours suggests that they may be dehydrated. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend: the new NCLEX RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. Which of the following statements from the patient indicates that they may have an epidural hematoma? The options given for this question on the screen are: Option A, I have been experiencing headaches and dizziness since my fall. Option B, my vision has been blurry since I hit my head. Option C, I have a bump on my forehead where I hit my head. Option D, I lost consciousness for a few minutes after I fell. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time to think. Answer. D, I lost consciousness for a few minutes after I fell. The passage describes that epidural hematoma is often associated with temporary loss of consciousness, followed by a lucid period that then rapidly progresses to coma. Therefore, a patient who has lost consciousness for a few minutes after a head injury is more likely to have an epidural hematoma than the other options. Option A is incorrect because headaches and dizziness can be associated with many types of head injuries, not just epidural hematomas. Option B is incorrect because blurry vision is not specifically associated with epidural hematomas and could be a symptom of other head injuries or conditions. Option C is incorrect because a bump on the forehead indicates a superficial injury and does not provide information about potential brain injury. Which of the following statements from the patient indicates that they may have an epidural hematoma? The options given for this question on the screen are: the given option are: Option A, I hit my head really hard and felt dizzy for a few seconds. Option B, I have a headache and my vision is blurry. Option C, I have a bruise on my forehead. Option D, I fell and hit my head, but I didn't lose consciousness. Option E, I have a cut on my scalp that won't stop bleeding. Option F, I feel nauseous and have been vomiting since I hit my head. Option G, I can't remember what happened before I hit my head. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. The correct answers are D, I fell and hit my head, but I didn't lose consciousness, and G, I can't remember what happened before I hit my head. Epidural hematoma is a serious type of head injury that can occur due to arterial bleeding between the dura and skull. It is often associated with temporary loss of consciousness, followed by a lucid period that then rapidly progresses to coma. Therefore, the correct statements from the patient that indicate the possibility of epidural hematoma are, I fell and hit my head, but I didn't lose consciousness. And I can't remember what happened before I hit my head. These statements suggest that the patient may have had a lucid period after the injury, which is a common symptom of epidural hematoma. Option A suggests a mild concussion, which may or may not involve loss of consciousness. Option B suggests a headache and blurry vision, which may indicate a contusion or subdural hematoma. Option C suggests a contusion, which is a bruising type of injury to the brain tissue. Option E suggests a scalp injury, which may or may not be associated with a head injury. Option F suggests nausea and vomiting, which may indicate a concussion or other type of head injury. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. A 32-year-old male is brought to the emergency department after a motor vehicle accident. He is conscious but confused and complains of a headache. The nurse performs a neurological assessment and notes that the patient has a small laceration on his forehead. The patient's vital signs are stable, but he reports feeling nauseous. A CT scan of the head is ordered and shows a small epidural hematoma. Which of the following statements from the nurse indicates that she understands the severity of the patient's injury? The options given for this question on the screen are: Option A, an epidural hematoma is a minor injury that will heal on its own. Option B, the patient's symptoms are probably just a result of a mild concussion. Option C, an epidural hematoma forms from bleeding between the brain and the skull. Option D, subdural hematoma forms rapidly and is a surgical emergency. Option E, intracerebral hemorrhage is a common injury from head trauma. Option F, a subarachnoid hemorrhage only occurs spontaneously and is not related to trauma. Option G, epidural hematoma is the most serious type of hematoma and requires immediate surgical intervention. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. Answer: G, epidural hematoma is the most serious type of hematoma and requires immediate surgical intervention. Is the correct answer. A, incorrect. Epidural hematoma is a serious injury and should not be considered minor. It requires immediate medical attention and possibly surgery. B. Incorrect. The patient's symptoms, including confusion and nausea, are likely related to the epidural hematoma and not a mild concussion. C. Incorrect. This statement is partially correct, but the nurse needs to understand the severity of this injury. D. Incorrect. Subdural hematoma forms slowly and is not the type of injury seen in this patient's CT scan. E. Incorrect. Intracerebral hemorrhage is not the type of injury seen in this patient's CT scan. F. Incorrect. A subarachnoid hemorrhage can occur as a result of head trauma and is not only spontaneous. G. Correct. The nurse correctly identifies that an epidural hematoma is the most serious type of hematoma and requires immediate surgical intervention. The patient's symptoms and CT scan findings indicate that he has this type of injury and prompt medical attention is necessary to prevent further complications. Mrs. Bimmel, a 64-year-old female, has just undergone a craniotomy for a brain tumor. As the nurse responsible for her care, you are tasked with monitoring her postoperative status closely. You check on her every 30 to 60 minutes, monitor her vital signs, and assess her neurological status. You also check her head dressing frequently for signs of drainage and record the amount and color of any drainage from the drain every 8 hours. Which of the following statements from the nurse indicates that she is providing appropriate nursing care following a craniotomy? The options given for this question on the screen are: Option A, I will monitor the head dressing for signs of drainage every 4 hours. Option B, I will measure the amount and color of drainage from the drain every 12 hours. Option C, I will maintain fluid restriction at 2,500 ml/day. Option D, I will administer sedatives to promote sleep. Option E, I will provide range of motion exercises every 12 hours. Option F, I will monitor for dysrhythmias resulting from respiratory distress. Option G, I will notify the HCP immediately of excessive amounts of drainage or a saturated head dressing. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. Correct answer, G and A. Option A is correct because monitoring the head dressing for signs of drainage is crucial to detect any possible complications, such as infection. Checking every 4 hours would not be frequent enough to catch any changes in a timely manner. Option G is also correct because notifying the HCP immediately of excessive amounts of drainage or a saturated head dressing is essential to prevent further complications. Option B is incorrect because measuring the amount and color of drainage from the drain every 12 hours is not frequent enough to detect any changes in a timely manner. Option C is incorrect because fluid restriction should be maintained at 1,500 ml/day, not 2,500 ml/day. Option D is incorrect because administering sedatives is not indicated following a craniotomy. Option E is incorrect because range of motion exercises should be provided every 8 hours, not every 12 hours. Option F is incorrect because dysrhythmias resulting from respiratory distress are not commonly associated with a craniotomy. They may be caused by fluid or electrolyte imbalance. Which of the following statements said by the patient indicates that they may be experiencing Bell's palsy? The options given for this question on the screen are: Option A, I have been experiencing a gradual progressive weakness of my lower extremities and facial muscles. Option B, I have been having paresthesias and hypersensitivity to touch. Option C, I have been experiencing pain in my upper body and have an abnormal electroencephalogram. Option D, I have been having difficulty breathing and my respiratory status is being closely monitored. Option E, I have an elevated protein level in my CSF. Option F, I am experiencing weakness and paralysis on one side of my face. Option G, I am having difficulty chewing and have lost taste sensation. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. The correct options are F and G. Bell's palsy is characterized by paralysis of one side of the face, as well as loss of taste. Option A describes weakness of lower extremities, which is not characteristic of Bell's palsy. Option B describes paresthesias and hypersensitivity to touch, which may be indicative of Guillain-Barré syndrome. Option C describes pain and an abnormal electroencephalogram, which may be indicative of other neurological conditions. Option D describes difficulty breathing, which is a major concern in Guillain-Barré syndrome. Option E describes an elevated protein level in the CSF, which may be indicative of various neurological conditions. Therefore, options F and G are the correct answers as they are the only statements that describe symptoms characteristic of Bell's palsy. Which of the following statements from the patient indicates that they may have meningitis? The options given for this question on the screen are: Option A, the patient has a cough and runny nose. Option B, the patient has a mild headache. Option C, the patient has a fever and a red macular rash. Option D, the patient is experiencing abdominal pain. Option E, the patient has been taking antibiotics for a sinus infection. Option F, the patient has a positive reaction to Kernig's sign and Brudzinski's sign. Option G, the patient has a history of high blood pressure. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. The correct options are Option F and Option C. A. This option suggests symptoms of a common cold or flu and is not indicative of meningitis. B. A mild headache is a common symptom and not specific to meningitis. C. A fever and a red macular rash are signs of meningococcal meningitis, making this option correct. D. Abdominal pain is not a specific symptom of meningitis and is not included in the assessment findings. E. The use of antibiotics for a sinus infection suggests a bacterial infection, but it is not specific to meningitis. F. A positive reaction to Kernig's sign and Brudzinski's sign are classic signs of meningeal irritation, indicating possible meningitis. G. A history of high blood pressure is not related to meningitis. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.